Jonathan Bays loves to be outside and enjoys caring for animals, a passion he shares with his 3 children. But 3 years ago, while working with a herd of cattle, John suffered a serious head injury and was rushed to the hospital, where he suffered his first seizure. Since then, his wife Anna says he's had many more.
He has 1 or 2 a week, and it's something I'm always watching for.
In fact, she says the possibility of a seizure shapes her family's life. If John isn't feeling well, they don't go out because seizures in public are especially scary.
For me, that's quite a bit more stressful because I want to get him somewhere safe. And there have been times when we've been out and he's lying in the grass somewhere. And that's always a little more stressful because, first of all, there are people around who want to help, but that makes it a little harder to focus on him. And I always just want to get him to the car and get him back home, but that's not always possible. Sometimes we have to wait the seizures out.
Her husband knows certain things will trigger a seizure, so he avoids crowded, noisy places and fluorescent light.
I have him at church because of the microphones, the crowds, and the fluorescent lights, and it's really embarrassing.
Often he'll have one seizure after another, and that worries Dr. Robert Wechsler, medical director of the Idaho Comprehensive Epilepsy Center. So-called seizure clusters can lead to injuries and, over time, brain damage.
If patients have clusters, we need to recognize it. So probably the biggest frontline unmet need is to have that conversation with the patient, identify the pattern, and formulate a plan. The next step that we need is more therapeutic options to rescue those patients when the clusters do happen. Whether it's different medications, different routes of administration, anything we can do to stop that seizure emergency before it escalates to the point of being a danger to the patient or requiring an emergency room visit or a hospitalization.
So John takes 2 different drugs to try and prevent seizures and seizure clusters. But Dr. Wechsler says it's essential for John and other epilepsy patients and their caregivers to be prepared.
We need to know who the caregivers are that are going to be responsible. Are they present? Do they know what the usual seizure looks like? Are they able to distinguish that this is something that's deviated from the normal pattern? The next step is what to do about it, whether it's calling for help, calling 911, getting the patient to an emergency room, or administering some sort of a rescue medicine at home. And that really has to be individualized depending on the patient's unique situation.
For more information about seizure clusters, visit seizureclustersconnect.com/Facebook.